Hi, my name is Nathan Jove. I'm with Atlanta Bone and Joint Specialists. Today we have Bryan Ruchin from Atlanta Rehabilitation here to talk to us about total joint replacement in the outpatient setting.
So it's very important, the rehabilitation after joint replacement. And what we've done over the last year or so is recognize the importance of early intervention, not only prehab, which is rehabilitation before the surgery, and then immediate post-operative rehabilitation. We have a select criteria that Dr. Jove and I use to select the patients that will benefit most from outpatient total joint therapy. Dr. Jove, what's your criteria?
So what we're looking for is we're going to be looking for our younger patients, probably age 50 to about 65. We're looking for patients who have very few steps in their house, who have excellent family support, so they've got people with them at all times after surgery. We look for patients that are pretty tough. They have to not have any prior pain medications that they're chronically on. That tends to make pain control very difficult after surgery. We're looking for patients who really are going to be able to tolerate early rehab with you guys to make sure that day one after surgery they're even able to get to outpatient physical therapy. It's extremely important. So we're looking at those criteria as kind of our main stance as to who would be the best candidate. And right now, we're seeing more and more of an aging population, in 50s and 60s that are requiring joint replacements and are much better candidates. Again, this isn't for your 95-year-old with severe arthritis who has no help at home. This is for your 55-year-old male who may have torn his ACL when he was younger, active, walking, jogging, running, who wants to do rehab early, wants to get back quickly, and again, someone who I believe is going to have the ability to do that.
So we take his criteria and then we replicate it on our side. These patients come in post-op day one, they're discharged from the hospital, then they're in our office immediately the next day with that family support, with that help, and we teach them all the techniques that we can use for rehabilitation. We teach them how to be functional at home, we teach them safety, we teach them how to walk again, we teach them how to build up their strength and regain their range of motion again, all done quicker than we typically did 5 and 10 years ago.
Yeah, and the other thing, when you guys are doing this, we do a prehab as well. When you're looking in the prehab, you're actually helping me as well to do this. What do you look for in a prehab candidate for a knee replacement? What are the things that you guys look for that might say this is not the right person?
That's an excellent question. We look for good range of motion. Doesn't have to be excellent because there is some type of arthritis in the joint, but good range of motion, good strength. Functionally, they're able to do the things they need to do. It's not like they can't go up and down stairs, it just causes them some pain. They're not walking with a cane or a walker, but they would prefer to because of pain. These people that tolerate the outpatient total joint better are ones that are functional, but they do have the pain related to it. But the family support is probably one of the biggest things that helps. You have to have a coach there. You have to have somebody there to push you and make you do the things that we teach you, both from a prehab standpoint and a post-op standpoint.
Excellent. With your outpatient joints, once they come in, they're coming in the day one after surgery. It's a little bit intimidating for them. They're very nervous. Obviously, you're about to push on their knee or their hip and make sure they're moving. What kind of things do you tell them in advance to coming into their first post-operative visit?
So during their prehab visit, we discuss pain management techniques. We go over a pain sciences talk, which kind of explains why they're hurting and what's hurting, and help them kind of rationalize what's going on. And we found that the more the patient understands, the better they can control themselves and control the pain and just accept what's going on and realize that this is only temporary and it will get better.
Excellent. Well, thank you very much for your time. Obviously, the rehabilitation standpoint after surgery is extremely important, and getting to know some of our therapists next door that work with us to make sure our outpatient joints are successful is extremely important. Getting to see their faces, learning who they are, and getting access to them is extremely important for your post-operative rehab. So thank you for taking time to talk to us today.
Thank you.